We can learn a lot more from our blood pressure number than just was it too high or did I get a passing grade? And when it's too high, most people view it like, oh, I must just be too stressed or too old. But you can tell a lot more about how your body is operating by looking at your blood pressure number. So in this video, we're going to pull back the curtain on that blood pressure number a little bit and also help people understand that low blood pressure can be just as problematic as high blood pressure. Here we go.
TC Hale is not a doctor and does not claim to be a doctor or licensed in any type of medical field. Don't be an idiot and use anything heard on the show as medical advice. This information should be used for educational purposes only, and you should contact your doctor for any medical advice. Now get off me.
So when we're looking at our blood pressure number, it's giving us an idea of the level of minerals in the system, also blood glucose, protein a little bit, and even filth and junk that hasn't been properly removed from the body. So if any of these things are higher than they should be, they can thicken up the blood, and then that causes the body to raise the pressure needed to push it through the system. Think about it. What would be easier to push through the veins? Something similar to red wine or pancake syrup. Pancake syrup would be harder to push through the system. It would need more pressure to get it through the system. So when we see high blood pressure, it often means that one of these things has gone high, or a variety of them have gone high, and thickened up the blood and increased the pressure needed to push it through the system. Higher levels of blood sugar can thicken up our blood. That's why we often see high blood pressure go right along with type 2 diabetics. They have a higher level of sugar in their system, and we understand that. And that sugar can thicken up the blood and raise that blood pressure. That's why it can be nice to look at your blood pressure in conjunction with your fasting glucose number. You can get a glucometer pretty cheap at any pharmacy, and you can check your fasting blood glucose number as soon as you wake up. Check that number then, and if it's 100 or higher, that's an indication that your blood sugar is leaning higher than it should. If that's the case, you know that part of what's making your blood pressure number higher could be glucose. And when we see people bring that fasting glucose number down, we often see blood pressure come down right along with it because the blood is not so thick now that it has less glucose thickening it up. When we see blood pressure that's too low, like maybe a systolic number under 112, that can be an indication of maybe some of these things are too low, especially minerals. That's very common to see very low minerals in the system when we see low blood pressure. This seems to be most commonly caused by digestive malfunctions that are restricting the person's ability to properly break down their food and pull the minerals out of that food. Blood sugar may also be going low if a person's dealing with hypoglycemic type issues, where blood sugars may be going too low, and then we see that blood pressure really come down. Either minerals or glucose going too low can create a lot of problems. The body uses these minerals in the system to send signals from the brain down to the body and from the body back to the brain. So when there's not enough minerals and a person has really low blood pressure, we often see issues like ADHD, depression, chronic fatigue, anxiety, and a lot of issues like that. There's a lot of problems that can come about from blood pressure being too low. Now, all those things I just listed have other possible underlying causes as well, but when we're seeing these symptoms, low mineral levels is often at least a contributing factor. So if your doctor looks at your blood pressure of 98/60, he's like, great job, way to go there, champ. He's saying great job because your blood pressure is so low that you're less likely to have a heart attack or a stroke. Basically, you're not going to have a blowout. But for the person dealing with this low blood pressure, is it any fun to drive around on flat tires all day? So if you have low blood pressure and you're dealing with any type of digestive symptoms at all, whether it's burping or bloating or constipation or diarrhea or acid reflux or nausea or even acne or skin type issues, any of those things are strong indications that digestion is not working correctly. So we'll put a link to our totally free digestion course in the description below this video, and it'll kind of walk you through figuring out, are there aspects of digestion that aren't working correctly? And if so, what steps can I take to improve those? Because you really want to improve your ability to get the nutrients out of the food you're eating. That's why you're eating the food. You want the nutrients in that food. Now, digestive malfunctions can also create problems for high blood pressure. When the liver filters out all the junk and toxins and filth out of the body, it puts that filth in our bile. And bile is a soapy substance that the liver makes, and then it stores in the gallbladder, and it comes down and helps us digest our food correctly. But as this bile is moving through the intestinal tract, it takes all these filth and toxins that the liver filters out, and it takes them out the back door when we poop like a champion. So this is the body's main detox strategy. But it's really common today for someone's bile to become too thick and sticky to flow correctly. So now all this filth and junk that the liver's filtering out, it doesn't move because the bile's not moving. So it doesn't go out the back door. So instead of these toxins leaving the body, they get reassimilated and the liver's got to filter it out all over again, and it eventually gets overwhelmed, and this filth and junk can thicken up our blood and raise the pressure needed to push that blood through the system. So when we see high blood pressure, it's really common to see poor bile flow and an inability for the body to remove toxins. To get an accurate idea of what's really going on, you really want to take your blood pressure at an appropriate time. Like, you don't want to take your blood pressure right when you wake up, because the body is still getting rid of a lot of the filth and junk that it was working on removing overnight while you were sleeping. So it's best to take your blood pressure at least 2 hours after a meal, but not fasting first thing in the morning. Blood glucose is great to take first thing in the morning, but not your blood pressure. You don't want to take your blood pressure right after you just had potato chips and cheeseburger, because all those carbohydrates and sugars are going to thicken up your blood and raise that blood pressure. So you really want to see what your body is doing when it's in between meals, when it's at rest, when it's like, hey, this is where I am in my normal state. That's when you want to look at your blood pressure to get an idea of, is it too high or is it even too low and causing problems in that direction? When you're looking at the systolic number, we really don't like to see anything below 112 or over 140. But any degree of a little bit too high or a little bit too low can give you indications of steps you might be able to take to help your body function a little bit better. Another insight you can gain from your blood pressure number is how your autonomic nervous system is running. Our autonomic nervous system is in charge of running a lot of the operations kind of behind the curtains, things that we don't really think about. We don't think about our heart beating or us breathing. These things just kind of happen. But if someone is stuck too far on the sympathetic fight or flight side of things, it can create some symptoms. And if a person's too stuck on the parasympathetic rest and digest side of that autonomic nervous system, that can create a lot of symptoms too. So what we can do is we can look at what we call a pulse pressure. And you find that by taking your systolic blood pressure number, that top number, and subtract the diastolic number, or the bottom number. And that gives you a pulse pressure. So if that pulse pressure is greater than 46, that's an indication that a person may be leaning too far on that sympathetic fight or flight side. And maybe this is happening because they're too stressed in their life, or maybe their body is stressed because it's dealing with some type of burden or low resources and doesn't have all the resources it needs to function correctly. It's kind of stressing out about that. So when a person is too far on that sympathetic side, it can actually constrict the vascular system, raising the blood pressure needed to push the blood through the system. So some people may have high blood pressure just because they're too far on that sympathetic fight or flight side. Now, if someone's too far on the parasympathetic side, their pulse pressure would probably be less than 37. That can be an indication they're leaning too far on that side. And in an extreme parasympathetic imbalance, we often see issues like seasonal allergies and asthma. So if someone's dealing with these issues, they can watch their pulse pressure number and take steps to push them out of that imbalance and improve some of those symptoms. If someone's leaning too sympathetic, they might fly out the handle at little things. All of a sudden they're yelling at the mailman because they don't like the shorts that they're wearing. And maybe they're not a jerk, they might be a jerk, but it might just be a situation where their body is too stuck in that fight or flight state, so they fly off the handle at silly little things. So you can see, you can gain a lot of insights about how your body is operating just by looking a little bit further into that blood pressure number. So if you are having any digestive issues, or maybe your blood pressure is too low, we'll put the link to that free digestion course in the description below. And if your blood pressure is too high, check out our video on 10 signs of poor bile flow to see if maybe there's an issue with your bile not flowing correctly and raising the filth and toxins in the system. I can't wait to hear about your results.